So let's understand and analyze, learn about yoga mudra for low or high BP. The BP may be, blood pressure may be high or low. So what is the normal average BP? What is the average BP? So that is what is going to be observed, and they try to understand in the hospitals and all, right? So that will be about 80 to 130. 80 to 130 is the BP, my dear friends. So many of us will be observing. Many of us all will be observing in the hospitals. They'll be measuring your BP. When they measure the BP, obviously they will check it out, and they say that so-called the BP value is 80 to 130. If it is above 130, you will be declared as a high BP patient. Isn't it? The high BP patient, because you will be declared, the reason is you got your BP value is more. Okay. So like that. So my dear friends, so this especially this low BP, high BP, both will be controlled. Both will be controlled by so-called this mudra, which is Dhyana mudra. Dhyana mudra is going to control you. So try to practice this Dhyana mudra all the time. So what is the Dhyana mudra? This is the both hands. Just will be touching these two, like your index finger and middle finger with the thumb. See, this is the Dhyana mudra. This is the Dhyana mudra. If you practice this Dhyana mudra, this is going to take care of your high BP or low BP, both. Okay, so try to understand this and practice this for 15 minutes at one shot, then followed by your prana mudra for 15 minutes. This is going to take care of. So you can teach this. You can teach this mudra, Apana mudra and Dhyana mudra to all the people whom you know. Okay, ask everybody to practice. So they'll definitely get the benefit. They'll give the instant results, my dear friend. Instant results will come. That is the power of mudras. Any mudra you take. Okay. Now, coming to understanding about let's understand acupressure points for the high blood pressure. We have basically 5 points. Okay, these 5 points, if you are operating, you will be able to come out of high blood pressure. The other mudra, what I have shown you, Dhyana mudra, is for low BP, high BP. It will balance. The BP, which is 80 to 130, we consider 80 to 120, we consider as a normal value as per medical science, medical system. So if it is anything going beyond 120, 130, 150, that is going to be high BP. So that will be coming down because of Dhyana mudra. If anything low BP, it will brought back. So that means 80 to 130, 120 will be maintained always with the help of